In recent years, body contouring has become one of the most sought-after procedures in the field of aesthetic medicine. With continuous advancements in techniques and technology, patients today can achieve more natural, refined, and lasting results. To talk more about the different techniques of arms, abdomen, and thigh contouring, and to understand how results can be improved and maintained after surgery, we are delighted to have with us today Dr. Nadi Saqr. He's a specialist in plastic surgery. So hello and good morning, doctor.
Hello, good morning, and good morning, Kuwait.
Well, we are happy to have you in Good Morning Kuwait.
Yes, of course, I'm happy. Have
so,
the pleasure.
Actually, doctor, is really an important, let's say, topic for all women and also men about the body contouring. We're gonna actually specialize, or let's say specific in the main topic about each part of the body later on. But first of all, we'd like to know the definition of the body contouring.
Oh, the definition of body contouring is simply to contour the body or to reshape the body by tightening the redundant areas, especially after weight loss, and by redistributing fat from the areas where it is redundant or excessive to the areas where it is deficient, as you know.
Yeah, so what are the goals that aims for the body contouring?
The goals of body contouring actually is to return the body to the ideal or to the previous state or shape, because people start with a contoured body, with tight skin, with flat belly, with fat very well distributed, but as they age or they lose and gain weight or repeated pregnancy, they started to lose this ideal or optimal shape, and there is a redundancy in all over the body or in some parts of the body. So the aim of the body contouring is to return the body to the tight shape with optimal fat distribution.
Well, that's great. So let's begin with the arms. What are the best techniques used for the arms contouring?
In the arms contouring, or in most areas of the body, the contouring depends on the content of fat and the tightness of the skin. Like if there is only fatty deposits and the skin is tight, actually liposuction will be the best, will give us the best result. If there is much redundancy but very little fatty deposits, then contouring by arm lift, whether it's axillary arm lift or longitudinal arm lift, will give us the best result. But sometimes it's like partially fat and partially redundant, and here comes the choice or the decision of the doctor with his experience to choose a mixture of both. Because sometimes we do both. We do liposuction and we do arm lift at the same patient. And with the advanced techniques available to us nowadays, like laser and J-plasma, many patients start to benefit from non-invasive arm contouring by using like liposuction and J-plasma, and in many cases we can avoid the scar of the arm lift.
That's amazing. So actually it depends on each cases.
Yes, of course. It's an individualized approach that we suit it to each individual case according to examination and requirements of the patient.
So are there any new technology for the arms contouring methods?
Yes, as I told you, of course, in the arm contouring or in the contouring in general, we start from like a graded approach. We start from the less invasive to the more invasive. Because I'm a plastic surgeon, so patients usually come to me after they tried other methods and have not gained the result that they like. But usually, most of the patients can start with some non-invasive like Althera, like ultrasound therapy, like radio frequency, and cryotherapy. This can give some patients some moderate improvement. But when these results are not enough for the patient, or they are not satisfied enough, they can come to the surgeon. And also with the surgeon, we also try to be less invasive as much as possible. Like in some patients, we will not resort to surgery if the liposuction and the J-plasma will give us the good result. But we resort to the surgery when it is necessary to give the patient the results that they seek.
Okay, so moving from the arms to abdomen, one of the most concerned area for most people. They want to get rid of like in many ways. So let's talk about the technology of techniques for the abdomen.
Yes, the abdomen, because all areas are affected by weight loss, but the abdomen especially is also affected by weight loss, whether due to bariatric surgery or due to exercise and diet, but it also affected by repeated pregnancy. So the abdomen is the center of the most techniques of contouring, because it's affected by many things that may not affect other parts of the body. So the contouring of the abdomen also depends on many cases that we can find during examination. It depends on the fat content and fat distribution. It depends on the degree of redundancy, on the shape of the umbilicus, and whether there are some hernias or not, and also the weakness or strength of the recti muscle. And also depends also on where the redundancy is mostly found. And according to all of these, we can decide on the proper technique to do for the abdominal contouring. The proper technique can range from the non-invasive, like cryotherapy, like mesotherapy to make lipolysis of the fat, to cryotherapy, to Althera, to ultrasound techniques. And these are the things that we start with. And for the more advanced cases, or the cases with a more fatty deposit, we resort to liposuction or liposculpture. And of course, this is a very common question, especially they ask it in Arabic: what is the difference between شفط الدهون and نحت الجسم? يعني liposuction and liposculpture. Of course, the simple answer to this question is that when we do liposuction, we focus on the fat that we remove. When we do liposculpture, we focus on the fat that we leave. When we do liposuction, we remove some amount of fat and the patient gets a little slim. But when we do liposculpture, we try to shape the remaining fat to be in the optimal place, in the optimal contour, in the optimal lines, to give the patient a proper shape. When liposuction is not enough, there are maybe something new to the patients, that they should know that the abdominoplasty or tummy tuck is not only a single technique. It's many types of techniques. And we start from the mini abdominoplasty, which is sometimes suitable for patients who have only small redundancy in the lower part of the abdomen, but the umbilicus is good, there is no hernia, there is no need.
Some people actually, doctor, do some six-packs for them. Is that because it's a part of the sculpting the abdomen, or different?
Six packs is to make the patient appear or have a muscular appearance, and of course not every patient is insisting on this. Some patients, they want to, because as you go more and more muscular, you go more and more to the male side of the spectrum. So I think in most patients, I give them some shadow of six packs, some shadow, some change that resemble the woman when she was young, like when she was 18 years old. But the full six packs, only maybe a few people could ask for. But anyway, in any patient where I do abdominoplasty or I do liposuction, I need to give them some liposuction or some liposculpture to give them some form of six packs. Maybe not the full-blown picture, but some picture of six packs.
That's amazing. So, doctor, let's move on to the thigh contouring. Is it really considered challenging, doctor?
Thigh contouring in our hands is not challenging. Actually, we do the surgery in a short time, and also the contouring can range from liposuction. And strangely enough, maybe some people, they will think that thigh contouring is difficult, but sometimes I do liposuction of the thighs under local anesthesia, and I can do it maybe in 1 hour, and after 2 hours the patient can go home and start moving. So it's not actually for us, because actually we have done maybe hundreds of thousands of cases. So this is for us is a simple procedure. And when the patient needs something more than liposuction of the thighs, we have other options. We can have like if the patient have some fat deposits but little redundancy, we don't need to go to surgery. We need to also keep things less invasive. So in these cases, we can also achieve good result with liposuction together with J-plasma or together with laser. So we remove the fatty deposits and give a good size of the thigh, but we contour the skin and make it tight with non-invasive things.
So how can we actually improve the results after the plastic surgery for the thighs, arms, and the abdomen?
Actually, improving the results depends on many things, and it starts early before surgery. It starts in the first consultation or the first interview with the patient is to optimize the patient. Like if you think of it like this, you don't take the patient to the surgery and then he loses some blood and then he takes a blood transfusion. This is not the optimal thing. The optimal thing is to make the patient well prepared before surgery. If any comorbidities, which is usually sometimes present, like diabetes, hypothyroidism, something that leads to hypercoagulability, hypertension, it should be in mind and it should be improved before surgery. We have to do CBC and check the hemoglobin of the patient and iron content. And we try to improve all these aspects before the patient goes to surgery. Also, some patients are taking like blood thinning medications, tablets, because sometimes they have some DVT, something in the heart. So if we go to the surgery with these medications on, there is a tendency to bleeding more than usual. So if we improve all these before we go to surgery, and then we discuss the surgery with the patient, the patient understands what I can do, what is the result to expect, and what is the complications also to expect, and he has a realistic expectations from the results. Both the patient and the doctor will be happy after the surgery, of course.
That's amazing. I'm pretty sure it's going to be an easy and let's say a beautiful lifestyle after having those surgery. And of course, they have to take care of their lifestyle with their diet, exercise. They have to maintain their healthy lifestyle, isn't it, doctor?
Yes, of course. Beauty is not just do something and then forget everything.
Exactly. So it starts from within.
Yes, to be beautiful, you have to adopt a lifestyle with controlled diets, with repeated exercise, because it's not only good for your weight, but it's good also for your overall health. And it's necessary to keep like a stable weight, like 2 kilogram up to 2 kilogram down. Then you can stay healthy, and you can keep the result of the beautiful result that we give you during the surgery. It will be lasting with you.
That was really
a long time.
Amazing, actually, interview, doctor. Thank you for golden information.
Thank you very much. I'm very pleased to be with you here.
Well, big thanks and appreciation to our dear guest, Dr. Nadi Saqr. He's a specialist in plastic surgery. So, dear viewers, that is for our interview for today and for our episode. I hope you enjoyed it as much as we did. See you for next time and have a lovely day. Bye-bye.